On this Tuesday night, Canada's dangerous new wave of variant cases.
It really felt like Groundhog Day.
The surge in cases and hospitalizations and warnings the pandemic is entering a new phase. Big blow to business.
No one saw it coming.
The shock and consequences of BC's circuit breaker lockdown. A new report card exposing tragic shortcomings in Canada's long-term care homes.
We have a grossly underfunded system.
And virtual gurus.
There's just no opportunities for me.
The Canadian tech startup helping women find work.
Global National with Donna Friesen.
Good evening and thanks for joining us. There is news tonight about vaccines and variants. The highly transmissible variants of COVID-19 are on the rise in parts of this country, and public health experts warn this third wave is unlike the first two. Case counts are climbing faster. Younger people are getting sicker. Hospital ICUs are filling up. Today, Prime Minister Justin Trudeau said anyone thinking of gathering for Easter or Passover should know the situation is now more dangerous than it's ever been.
I know I've said the same thing before every major holiday over the past year, but this time, what's different is that even if the end of the pandemic is in sight, the variants mean the situation is even more serious.
Over the last week, the number of new variant cases in Canada jumped 64%. More than 9,000 have now been confirmed, and Canada's Public Health Agency says that's just the tip of the iceberg. Thousands of other tests that have shown red flags for the variants are waiting to be confirmed. In the last week, the number of COVID patients in intensive care units rose 14%. The need for vaccines is acute. The federal government promised today more are on the way, and NowFit Now says to get every Canadian at least one dose well before the end of September. More on that in just a moment. But we begin with the variants. They are winning the race against vaccines right now, especially in BC and Ontario, where scientists say the situation is completely out of control. Eric Sorensen begins our coverage tonight.
What could be more encouraging in a COVID hotspot like Toronto than better weather and a loosening of restrictions for activities like outdoor dining? But don't be misled. Nearby, inside some Toronto and area hospitals, a much more discouraging scene. Hospital beds and intensive care units are filling up again. Ontario's Science Advisory Panel suggests COVID variants now account for 67% of all COVID cases in the province. And they seem to be hitting younger people. The percentage of patients under age 60 in ICU beds has risen 50% since December.
So they're younger. They're younger and they're sicker.
This emergency room doctor says it's as bad as it was in January.
Yesterday, I had an emergency shift, and it really felt like I felt at the peak of wave 2.
Here are the COVID curves for Ontario since December for infections, for hospitalizations, and for ICU cases. The second wave happened in January, but now you can clearly see a third wave has begun in March. Note, there was a provincial lockdown just after Christmas. As of March 28th, there were just as many infections as there were on December 26th. And for ICU cases and for hospitalizations, the numbers are even higher now than they were then. And these numbers will continue to rise. Ontario is preparing 2 field hospitals, this one in Toronto and another in Hamilton, to increase hospital capacity. But as demand for ICU beds is sure to increase, so are demands for another lockdown.
Right now, what we're seeing in the GTA, they need to put on the emergency brake, and they need to close schools.
Closing schools would be a very big change of course for Ontario. Premier Doug Ford says he's prepared to act, but for now is only warning against travel and gatherings over the Easter weekend.
I'm asking you, don't make plans for Easter. That's what I can tell you. I won't hesitate to lock things down if we have to. I did it before, I'll do it again.
Another hopeful sign, vaccinations. But it's clear they won't protect us soon enough to avert what's happening now.
It's not going to stop the third wave. It may blunt the impact of the third wave and maybe shorten its duration somewhat. But we're going to have some suffering in the next few weeks or months.
A tough time ahead for Ontario, and it's not the only province.
I'm Robin Gill in Whistler, BC. The resort has been shut down because those variants are taking hold in this community. It's a major setback, and it feels very much like March 2020 all over again.
This is what skiers look forward to, a bluebird day. But the lifts aren't moving. The passes now a waste.
We thought it's safe.
Best place to be is outside.
These spring breakers can't catch a break. The ski hill was closed last year at the same time.
This is what happened last year too with these kids. It was like as soon as their spring break started was the same day that the mountain closed down last year.
The province has shut Whistler Blackcomb, and workers don't know what's happening next.
It's an abrupt end to the season for sure, which, yeah, no one saw it coming.
This is the height of the spring ski season, and it's a big economic bite.
Is that taking a sledgehammer to your business?
This year has dramatically impacted us. We're a tourism community, and that's what keeps this place going. And in a COVID world, there is no real economy in our community, which is why it's so important to get to the other side of this.
The province's public health officer is clamping down because cases are high in this part of British Columbia.
We're starting to see cases increase again in that community, and particularly in the past week with the more worrisome cluster of the P1 Brazil variant of concern.
We have the variants in circulation, particularly the UK variant, the Brazilian variant, and these are significantly more transmissible, probably twice as contagious.
The message has always been get outside. It was the safest bet, but it's what happened in the après that is taking away the fun.
Skiing is what kept me sane through the whole pandemic, just to get outdoors and have some outdoor fun.
It's a 3-week pause here, and it's taking a big chunk out of the spring ski season, much like it did last year. A spokesperson for the resort says it was caught by surprise, but it will comply with health orders. Donna?
All right, Robin Gill in Whistler, BC, thanks. Quebec is also seeing a steady rise in cases. The Premier warns tighter restrictions may be needed there, too. The highest case counts are in 5 regions outside Montreal. Premier François Legault says the biggest concern is social gatherings. Police have been ordered to crack down on rule breakers over the Easter weekend. The Quebec government is also considering moving the 9:30 p.m. curfew back to 8 p.m. Prime Minister Justin Trudeau revealed today more vaccine doses are on the way sooner than expected. The timeline for most Canadian adults to be vaccinated will move up as a result. Confidence in the vaccine rollout, though, has taken a hit with all the changing advice about who should avoid the AstraZeneca shot. As Couteur explains, public health officials are trying to drive home the message that any vaccine you are eligible for is still your best shot.
C'est possible que beaucoup de gens aient au moins leur première dose.
Prime Minister Justin Trudeau says it's possible a lot of Canadians will have at least their first dose of vaccine before summer even really starts. That confidence comes as he announced Pfizer is moving up delivery of 5 million doses of the COVID-19 vaccine.
Combined across the currently approved vaccines, Canada is now on track to receive at least 44 million doses of vaccine by the end of June.
That doesn't include the single-dose Johnson & Johnson vaccine. Canada will start receiving those shipments at the end of April. But it does include the Oxford AstraZeneca vaccine, which has been getting a lukewarm reception on the street since the National Advisory Committee on Immunization is recommending provinces pause delivery of that vaccine to adults under the age of 55 because of rare reports of blood clots.
Yes, I would be very afraid to take it.
Why is that?
Because it's not safe yet.
This man's first shot was from Pfizer, and if his second dose has to be AstraZeneca or nothing...
Yeah, I would do it. Yeah, I wouldn't let it deter me from taking it, but I would definitely, if I had a choice, I would opt for another option.
But we're not supposed to. No.
Hoping to halt that hesitancy, Prime Minister Trudeau has been touring vaccination clinics like this one in Ottawa, reinforcing the notion that you should take the first vaccine you're offered. That message is being echoed by Quebec Premier François Legault, who was given the Pfizer shot last week.
The AstraZeneca vaccine is safe for people over 55. The greater risk is to refuse to get vaccinated.
Canada's top doctor says science is shifting to keep up with the real-world data.
An initial clinical trial with tens of thousands will not pick up rare events.
Dr. Tam adds, as more people get vaccinated, the science continues to evolve and guidance for vaccines will have to follow. Donna?
Couteur, thanks. We know the heartbreaking toll the pandemic has taken on residents in long-term care homes in Canada. Now there is new context about just how dismal medical care was in many of those homes and how Canada compares to other countries. Of all the deaths from COVID-19 in Canada, 69% were in long-term care homes. The international average is 41%. And as Ross Lord reports, there are mixed opinions on how much things have changed.
In the spirit of understanding a problem before we can fix it, the Canadian Institute for Health Information is drilling down on the devastation in long-term care homes. Some of the findings are already widely known, that long-term care and retirement homes have been disproportionately affected by COVID-19 in Canada. Others are revealing, like this one. Long-term care residents received less medical care during the first wave than in normal years, meaning fewer physician visits. And they were less often transferred to hospital for the treatment of chronic conditions and infections. Residents also had fewer contacts with friends and family, which was associated with higher rates of depression. The total number of resident deaths from all causes was higher than normal during the first wave, even in parts of the country with fewer COVID-19 cases.
So when you saw significant growth in the rate of what we call excess deaths in these settings, it really showed that it wasn't just due to COVID itself, but it was actually a collapse in the provision of care that was occurring in many of these homes.
The report says nearly 1 in 3 long-term care homes experienced an outbreak during the first wave.
We have a grossly underfunded system. In Canada, where we rank number 1 in the world of having our deaths at such a high proportion in our long-term care homes.
The good news? Funding and staffing is increasing, measures that helped Quebec greatly reduce long-term care deaths in the second wave. The Ontario government is recruiting thousands of frontline workers, a move applauded by nursing home owners, but a healthcare union fears the number of new arrivals won't keep pace with those leaving work from burnout, illness, and childcare.
This year alone in Ontario, we're training 6,000 PSWs. We're going to lose 10,000 to attrition alone.
A year after the pandemic started, making improvements for the future is still easier said than done. Ross Lord, Global News.
An arson investigation is underway in British Columbia after back-to-back fires at 3 halls operated by the Freemason Society. The first fire was reported shortly before 7 a.m. in North Vancouver. Less than an hour later, 2 more Masonic halls in the region were also on fire. Police say a 42-year-old man has now been arrested and arson charges are being recommended. The Prime Minister questioned about misconduct in the military. Coming up, what did he know about allegations against Canada's former top soldier? Prime Minister Trudeau was pressed today to clarify who knew what and when about a sexual misconduct allegation involving the highest ranks of the Canadian military. There have been conflicting comments about the 2018 allegation against General Jonathan Vance. Today, when the Prime Minister was asked directly whether he personally knew about it, he gave a clear and simple answer. Our Ottawa Bureau Chief Mercedes Stevenson explains.
When Global News first broke the story about sexual misconduct allegations against General Jonathan Vance, the Prime Minister and his office said neither Mr. Trudeau nor his staff were aware of those allegations, and that they learned about them from our reporting. A few weeks later, the Prime Minister's office changed its tune and admitted senior staff were aware of allegations being made in 2018. We wanted a clear answer from the Prime Minister on whether his answer had changed too. Here's how he responded today.
My office knew there was allegations that were brought forward. We did not know the substance of those allegations until the Global News reporting.
Prime Minister, did you know about any allegations of any concerns of sexual misconduct, regardless of the content, in 2018 or before and when you extended General Vance's term and gave him a raise?
No.
So what did you know at the time? Still, there are questions as to why senior staff or the Defence Minister, Harjit Sajjan, didn't think the Prime Minister should be made aware that allegations had been made, especially when extending Vance's term or giving him a pay raise. Last week, Minister Sajjan's claims about how he handled the Vance allegations were thrown into question at committee by expert testimony. The current military ombudsman backed assertions of his predecessor that Sajjan was the proper reporting authority for concerns about General Vance. The head of the Sensitive Investigations Unit for the Military Police also contradicts Sajjan's claim that reporting the allegation would have been political interference, a claim that Sajjan repeated again today. Donna?
All right, Mercedes Stevenson in Ottawa, thank you. And one more military note. A day before Canada's mission in Iraq was set to expire, the federal government has announced it is being extended. 500 Canadian troops are involved in Operation Impact now. The extension allows that to increase to up to 850 troops if needed until the end of next March. Canada has been helping a coalition of countries fight the so-called Islamic State in Iraq and Syria since 2014. Ahead, heinous attacks on Asian Americans prompt hate crime investigations. Police in New York are searching for suspects who carried out brutal assaults on Asian Americans. The latest happened in broad daylight in Midtown Manhattan. A 65-year-old woman was kicked and stomped on. It was caught on a security camera, and a warning: the video is disturbing. It happened outside an apartment building yesterday morning. A man approached the woman, kicked her in the stomach, and repeatedly stomped on her before walking away. She went to the hospital with serious injuries. A security guard inside the lobby watched it happen and did nothing. Another man closed the door to the building and left the woman on the ground. The building management company says they have been suspended. The police hate crimes unit is now asking for public help in identifying the suspect. And another attack on an Asian American man is also under investigation. He was beaten on this busy subway train in Brooklyn. It's not clear when it took place or what happened before the assault. We're not going to show you the whole thing. It's too violent. The assailant choked the man until he collapsed, and then he walked off the train at the next stop. The NYPD is asking the public for help in that case too, urging anyone with information to come forward. In Minneapolis, the teenager who took the video of George Floyd's arrests and his final moments took the stand in the second day of the murder trial of former police officer Derek Chauvin. She appeared off camera because she was a minor at the time. In her testimony, she described seeing Floyd as, she says, terrified, scared, and begging for his life. Chauvin pressed his knee on the 46-year-old black man's neck. Even though it was her video that brought the world's attention to Floyd's death, she says she feels remorse for being unable to help him.
I have a black father, I have a black brother, I have black friends. And I look at that and I look at how that could have been one of them. It's been nights. I stayed up apologizing and apologizing to George Floyd for not doing more and not physically interacting and not saving his life. But it's like, it's not what I should have done, it's what he should have done.
Chauvin is charged with second-degree murder, third-degree murder, and second-degree manslaughter in connection with Floyd's death. The trial will continue for several more weeks. Virtual gurus still ahead, the remote recruiters thriving in Alberta.
You're watching Global National.
A bright spot in the UK today. It was the warmest March day in 53 years. Temperatures soared to above 24 degrees in some places. It was convenient timing to enjoy the outdoors. Strict lockdown measures eased yesterday, allowing people to gather outside in groups of 6. And in Japan, the cherry blossoms are bursting into bloom earlier than any other year on record. The city of Kyoto has tracked the peak bloom date for over 1,200 years and says spring flowering has been shifting earlier over the past century. Well, finding moments of joy hasn't been easy in the last year, especially for those who have been forced out of work. In Alberta, employment of women has been driven down to a low not seen in 2 decades. It's a harsh reality a tech entrepreneur in Calgary is working to address. She has overcome a difficult past, and as Heather Urix West reports, she's now helping those who don't always fit into a corporate box.
Bobby Reset came to Calgary for the opportunities.
I moved here to work in oil and gas, just like a lot of people were moving out here to get oil and gas jobs.
At first, the work was steady. Reset was busy all the time. But when the price of oil collapsed in 2015, she and thousands of others were laid off.
At that time, There's a lot of people in Calgary trying to find work, and there's just no opportunities for me.
As an Indigenous member of the LGBTQ2 community, Rosette knew she was facing discrimination too. It's something she had watched her two moms struggle against for years.
From a young age, I've seen prejudices against us as our family. I've seen a lot of, it was a lot of heartbreak for us to deal with. That's essentially what compelled me to say, you know what, I got to be able to build a platform that I can do this, and that I can provide work to those that are going through the same thing as I am.
So how you doing, Stacey?
I'm doing good.
5 years later, Rosette is now the CEO of a rapidly growing tech startup. Virtual Gurus connects companies with skilled assistants who work remotely, a model that is thriving during these COVID times.
I have like 5, 6 clients at the moment, and everyone's different. So every day is different. No 2 days are the same.
Stacey Wells is one of 400 contractors who is now working as a virtual assistant because of Rosette's company. Most of the contractors are women. Many, like Wells, are Indigenous and living in remote communities.
You know, sometimes I surprise myself, though, because I'll look online and I'll look in our community and I'll see all the people that we're providing work for. And, it's kind of it brings a tear to my eye sometimes.
This week, the company closed more than $1 million in new investment. There are big plans for growth. But for Rosette, every new hire still feels deeply personal.
Do you think back to your mom?
Yeah. Yeah, I always do. I always think back to what my mom went through.
And that's what drives her to keep striving for more. Heather Urix West, Global News, Calgary.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is Kinsman Park South in Regina. There are beautiful spots all over Canada. Please email yours to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.